During a routine 20-week ultrasound, the technician wasn't able to get a good image of our son's heart, so she referred us to CHAD, in which we met with a cardiologist at CHAD, and they did a fetal echocardiogram on his heart and a genetic study, and we received the diagnosis in September 11th, 2008, that he had hypoplastic left heart syndrome, which essentially means he was being born with only half of heart. So he would require either a full heart transplant at birth or a 3-stage surgery to extend the life. So throughout the rest of our pregnancy, we met with specialties at CHAD and were followed very closely during the end of our pregnancy. And Parker was born in Boston, where he's underwent 2 open heart surgeries to date, and in 2.5 weeks we'll have his 3rd open heart surgery. When we learned that our son, soon-to-be-born son, would need open heart surgery at birth, they told us it would be in Boston, and they referred us down to Boston. And when we went to Boston, they had already had all of our records from the cardiologist in New Hampshire, and our cardiologist at CHAD had sent all of our records and had been emailing them regularly, so there wasn't a lot of questions, and we met with CHAD to bring anything that we needed with us, and we didn't need to bring anything. And the communication has been great. In the past 2.5 years that we've been going between CHAD and Boston, there hasn't ever been a lapse in communication. They're always on the same page, so we never have question in our mind about his care, because they have such great open communications that it seems like the cardiologist in New Hampshire and the cardiologist in Boston are one and the same as far as direction, course of action, where we go from here. And it's just a very great feeling.
Yeah, when we first heard, my honest first thought was, I hope Casey's going to be able to cope with this as well as I think we both can. We've had many challenges, normal life challenges in the 7 years we were together prior to that. And I just saw it as one more challenge that we would somehow hurdle through.
When we first received the diagnosis that Parker had hypoplastic left heart syndrome, and you go home to research it, it's considered a terminal heart defect with no known cure. So we wanted to give our son the best odds possible, and in the research that we did, CHAD was in the best direction, telling us that Boston was #1, and we'd realized that doing our own research, that Children's Hospital Boston was #1 for this heart defect. And we felt very blessed and fortunate to be able to have CHAD as our local contact, to be able to go to all of our local appointments during our pregnancy. It was very convenient to not have to drive to Boston and struggle with the traffic and the parking and the hospital to go in for our weekly and bi-weekly appointments. We were able to have all of our appointments here in New Hampshire up until birth. And then since being discharged from Children's Hospital after his first 2 open heart surgeries, we've been able to have all of our follow-up care here right at CHAD. All of Parker's specialists are here in New Hampshire, so we're able to have all of his appointments here locally for his endocrinologist, his GI specialist, his cardiologist, his pediatrician, his synergist shots that he gets every month. So we're very fortunate that we don't have to drive to Boston for all of his appointments, because he does have many. Parker will be going in for his 3rd open heart surgery in 2.5 weeks. It's the 3rd and final stage surgery for hypoplastic left heart syndrome. We expect to only be there for about 2.5 weeks to 3 weeks, and he'll be jumping from hospital bed to hospital bed in no time. And hopefully it's the last surgery for some time to come.
I just feel very comfortable with everybody that's caring for Parker. Like Casey said, the fact, CHAD is great. Everybody, the specialty department is right next to the pediatrician department, so the communication's very quick. There were several times where they'd run down the hall to just check with the other one, just so we'd get a quick answer on whatever it is we were asking that day. And I'm just very happy that he's being seen at CHAD and also Children's in Boston.
Say apple.
Apple.
Can you say bye-bye?
Bye-bye.
Can you blow a kiss?
Oh, that's